Oh, there are three that I really want to talk about. The first is that people fear that they're dying. That's a misconception. When they get this disease, the word heart failure has the word failure in it, and so everyone really worries that they're going to have a poor outcome. But in fact, most patients improve, and 1 out of every 4 actually recover fully. The second misconception is that women often feel like they're alone. They don't know anyone else with this disease. And in fact, 55% of the patients with heart failure are women. So it affects women and men equally. The third is that they refer to it as one disease, just like we sometimes refer to cancer as one disease. But we know cancer has many different types. Heart failure has many different causes. High blood pressure, diabetes, valvular disease, and heart attacks are just a few. And in fact, patients can develop heart failure with weak hearts and strong hearts. And all of these factors actually affect how you do. The patients most at risk are actually people with high blood pressure, diabetes, and risk factors for heart attacks. So those are the most at risk. With regard to the symptoms, patients come in my office and their complaint is that I have shortness of breath and a cough that has gone on for weeks, and it has not gone away. They often think they have pneumonia because they have these symptoms, and they've tried antibiotics, and it doesn't go away. They think maybe it's asthma, so they try steroids, and it doesn't go away. So if you have symptoms that are not responding to ordinary therapy, then you really need to seek medical attention. Leg swelling is also common, but leg swelling alone is not a concern unless it's actually associated with shortness of breath. And then the third is actually that if patients are missed for a long period of time, they can get abdominal pain because the fluid can actually go to their belly. The very first thing you should do is seek medical attention because most patients approve on medical therapy. So that's the very first. But they should also know they're not alone. You really need emotional support because women often get depressed with this disease. And I'm very lucky to be a part of a group called WomenHeart, formed by women who had heart disease. It's a patient advocacy group that provides educational material as well as emotional support through peer group, one-on-one, and also telephone as well as online support. Yeah, it's exciting times. We actually have 2 new drugs that were recently FDA approved, and they've been incorporated into our guidelines. Both drugs actually have been shown to prevent hospitalizations for heart failure. One is a medication that actually reduces your heart rate, and the other one actually is a combination pill that lowers blood pressure. And the combination pill is the only drug that actually also prevents death due to heart disease. But like all medications, you do need to check with your medical provider to make sure it's safe and right for you. WomenHeart.org.